Hello everyone, my name is Dr. Madhadar and you're watching sqadia.com. Today our topic is the knee injuries. We'll be discussing mainly the meniscal injuries, especially as you know there are two menisci in our knee, that is the medial and the lateral meniscus. We'll be briefly discussing about both the medial and lateral meniscus injuries, their classification system, their treatment, and usually what are clinical features of meniscal injuries. Then we'll be going through the osteochondral injuries, also called as osteochondritis dissecans. This is basically injury of the cartilage, especially around the knee. We'll be briefly discussing in this section, but it can occur in the elbow, especially when it involves the capitulum of humerus, or in the ankle where it is involving the talus. We'll be discussing the injury of the chondral surface as well as the subchondral bone. Then will be the same thing, almost osteochondral injury and osteochondral dissecans is actually same name for same pathology. It is actually termed as it's an inflammation or chondritis of the cartilage, especially articular cartilage. Maybe due to trauma, it could be due to vascular results, but most commonly it's called a theory suggests that it is due to the avascular necrosis of the subchondral bone, leading to this type of injury, leading to a denudation of the articular cartilage and eventually leading to arthritis of the knee joint. Then we'll be discussing the knee injuries in children, which would involve mostly the tibial epiphyseal injuries, which is most commonly usually injuries seen around the knee, proximal tibial epiphyseal injury, and we'll be briefly going through the Salton-Harris classification, which involves the tibial epiphyseal injuries. Then we'll be discussing the proximal tibial metaphyseal fracture in children as well. Although these are the very rare injuries, but if they do occur, there is a phenomena called as Cosen's phenomena, which we'll be briefly discussing as well, what it is and why it is important to deal with these metaphyseal fractures early on and in a better way. Then we'll be discussing lastly the tibial tuberosity fractures, which is although again very rare in children, but if they do occur, they could be very problematic because whole mechanics of the knee is disturbed. As you know, the Patella tendon actually attaches on the tibial tuberosity, and this Patella tendon is formed by first the quadriceps attached on the patella, which is actually a sigmoid bone which is lying on inside the tendon, and then this patella tendon is a continuation of the quadriceps tendon and attaching it onto the tibial tuberosity. If that gets disturbed, the extensor mechanism can be disrupted regarding the knee. And then we'll be discussing lastly another very rare entity but very important, especially in the case of children, which is the patellar sleeve fractures. As you know, the patella ossifies at around 3 to 4 years. It starts ossification at 4 to 5 years of age, and as it is ossifying, there's a predominant cartilage. At this age, if it does occur, there may be a large fracture fragment, but may not be visible on X-ray because it's more cartilaginous. But when you open it up, it's important to recognize this as an entity because this can lead to disruption of the extensor mechanism and problems later on for the child. Keep watching sqadia.com. Thank you very much.